special interest in family medicine. Okay, so sinusitis is inflammation of the mucous membranes of the sinuses. So what are the sinuses, you might ask? Okay, so in your skull you have these air spaces, right, in the skull, and that's what you call the sinuses. You have a frontal sinus, you have a maxillary sinus, ethmoid sinus, etc. So these air spaces are necessary as part of the skull. Well, what do these sinuses do? They lighten the weight of your skull, first of all, and they also filter a lot of the dust particles, viruses, bacteria. When you breathe in, it filters it, as well as it warms the air and moistens the air so that by the time the air reaches the lungs, it's at adequate temperature. Now, when these sinuses become inflamed, you tend to get like thickening, you tend to get mucus buildup within the sinuses, and that's where problems can arise. So some of the symptoms of sinusitis include with all that buildup of mucus, you tend to get a runny nose, a stuffy nose, sneezing. Sometimes you might sneeze and a lot of mucus comes out, different colors, different thicknesses. You tend to get like a lot of pressure. Remember, because you have all this blockage now in your sinuses, so sometimes patients will come in and they will say, "Doc, I have a pressure right here, or my nose behind my eyes hurting, burning, the head just feels heavy, they feel unwell," right? Sometimes it might even affect their sense of smell, because now everything is just blocked up, there's just all this congestion, right? Some people might get a postnasal drip, which is some of the mucus drips down to the back of the throat. They get a little sore throat with it. Some people might get fever, right? Okay, so remember I told you guys that the purpose of the sinuses is to filter the air that you inhale, right? So sometimes if the air is too cold and too dry, it causes inflammation or swelling of that same mucosal lining within the sinuses, right? And also remember, these sinuses tend to trap different viruses, bacteria, fungi, or any allergens that might be present in the atmosphere. So like these days, there's a big talk of Sahara dust, and a lot of us have pets, so the animal fur, pollen from whatever trees are in bloom at the moment. So yeah, pretty much when these things deposit in the sinuses, and with the cold, dry air, the sinuses just start to it tends to become swollen and inflamed, and a lot of mucus tends to build up in the sinuses, right? And that's how it brings about all this pressure, all this pain, and all this mucus coming out of the nostrils. How do we avoid it? Okay, so as much as possible, try to minimize changes in temperature, because as I said, cold, dry air tends to trigger it. Well, we can't avoid changes in barometric pressure, but we have to be aware that when the seasons are changing, when the weather is changing, you tend to be more at risk for sinusitis. So what you can do, is to boost your immunity, right? So lots of fluids, try to get adequate rest. If there's an issue that there's a lot of Sahara dust in the atmosphere, perhaps consider wearing a mask. If you have to go out. What else? No smoking, no vaping. Try to live a healthy lifestyle, eat healthy so you get your vitamins, your minerals. Some people even invest in air purifiers, which have the HEPA filters, so the air that they breathe in will have as little bit of particles as possible, a little bit of those viruses, bacteria, etc. So yeah, just try to maintain a healthy lifestyle. That's what we can do naturally to help prevent sinusitis. Pretty much when these symptoms become unbearable, it's affecting your function, or you're worried that it's not getting better, because a lot of times the inflammation could go away on its own if there's no bacteria present. So some people tend to use steam inhalations you know, that warm, moist air, it tends to release a lot of the mucus that's built up in the sinuses. So a lot of times that tends to help along with your vitamins and your rest and your fluids, etc. But if that is not helping and you're feeling worse, sometimes even the mucus turns green or brown or blood stained, or you're just feeling really terrible, you know, that's when probably you might need antibiotics. So it's best to seek professional help. And for example, you can find me on the Cellmaflex platform, and you can book your appointments and come in. And when you come in, I will assess you, and more than likely you might need a saline nebulizer. So what the nebulizer does, it converts the saline, and sometimes we use the inhaled steroids, into a mist. And what that does, that mist goes into the sinuses, it soothes the inflammation, it helps bring down a lot of the trapped mucus, right? And it's all part of treatment. Okay.